Hello, my name is Darren. I'm a physical therapist at Optimum Therapies. I'm here today to talk to you briefly about a common problem called shoulder impingement. Many of you are having problems with complaints of pain in the outer parts of your shoulder. You can't sleep on your shoulder at night. You wake up in the morning, the shoulder feels really stiff. Maybe activities that are up overhead have gotten really tough for you to do. These are all common symptoms of shoulder impingement. Now, to understand shoulder impingement, you need to understand the shoulder itself. It's really a dynamic joint, lots of movement. It's supported by muscles surrounding your shoulder joint called your rotator cuff. Shoulder impingement typically occurs as we start to get into our 30s and our 40s. What happens with the impingement process is we have two structures, our biceps tendon and the muscle of our rotator cuff called our supraspinatus muscle. These two muscles get pinched between the bony umbrella here I call your acromion and the bone of the humeral head. As those muscles feel the pinch, they become more spasmed and tighter, drawing the humerus up underneath the bony acromion, making the problem even worse. This isn't the time to start doing strengthening exercises. I'd like to show you a real simple exercise to first pull the humerus down and restore space underneath the acromion before you start an appropriate therapeutic exercise program. The point in this impingement protection stretch is to start to pull the humerus down away from that bony acromion. We want to create space for those soft tissue structures. This can be easily done with a single household gallon jug. Depending on how sore your shoulder is, you may not be able to fill the jug all the way up with water. Start off half full or maybe a third full and see if your shoulder is going to be tolerant to the stretching. Sally, can you grab that for me? Just let it stretch there. The important part here is to really let the weight of the jug distract and pull the shoulder as it creates separation in the joint. Once you feel like you're nice and relaxed, you're going to use your body to kind of get the momentum going of the jug as the jug makes small circumferential circles. Initially, those circles are going to be small, 8 to 10 inches. As your shoulder starts to feel better, the circles are going to start to get much bigger. Remember, you need to allow the weight of the jug to take the shoulder around each circle. If you start to get too big too fast, the circle on your floor is going to start to look like an oval. You're trying to push your limits. I usually will do this 25 to 35 repetitions in a clockwise fashion, and then 25 to 35 in a counterclockwise fashion. Each time you're just stretching the shoulder out and creating more space. In time, you should feel more water go into the jug, and the circle diameter should get as large as a trash can lid. If there's any pain anytime during the exercise, please stop. If you're having shoulder impingements, don't wait. Come into your local PT and be assessed. We'll accurately diagnose the problem and get you directed in an appropriate therapeutic exercise program. It's your choice. Choose Optimum Therapies.